afternoon, everybody. My name is Darlene Stromstad. I'm the President and CEO of the Mohawk Valley Health System. Thank you for being with us today for what will be a brief briefing of the status here. Our priority remains the safety of our patients, our employees, our medical staff, and our community. And we are doing our part, everything we can, to help stop the spread of this virus. We have already placed many restrictions on services, limiting visitors, and limiting some of the things that we're doing, and we are going to be limiting some more. This community has responded very well and is doing what we've asked of them. That's the good news. They're staying home. But based on the experience of other parts of the state and what we're seeing in other states, we are preparing for a large surge in volume. We ask that everybody remain hypersensitive to stopping or at least curtailing the spread of this virus. We are responding to the governor's mandate that non-essential staff not come to work. We have implemented a 30-day workforce plan to provide employees authorized personal leave. Our goal is to keep people whole financially while at the same time be good stewards of our own organization. That went into effect last night. Also, we are developing a surge plan as required by the Department of Health in the state of New York. This plan is due tomorrow and requires that we have an opportunity to surge up 50% greater than what is our normal census. Toward that goal, we are looking for retired doctors and nurses who would be willing to help. Those individuals could call, I'm going to tell this number, 315-624-5607. That's 315-624-5607. We are eliminating non-essential surgeries and testing as mandated by the state effective Wednesday. We've already limited the services that we provide, but this takes it further. We will be limiting our physician practice locations and the number of laboratories we have open. So we ask that anyone with an appointment who plans on going to their doctor or to a lab, please call first to make sure that that location is open. We continue to be very focused on the safety of our staff on the front lines because we all need them to stay well. So in addition to education and training, we are drilling on patient movement throughout our buildings. We're very focused on conserving our supplies and resources. This requires that we discontinue with our drive-through testing site up on Burstone, effective this afternoon. For people who have appointments today, we will be testing them, but we do not plan on doing any more drive-through testing. This decision was made in conjunction with the County Health Department and Roe Memorial Hospital. We just simply do not have the testing kits or swabs necessary to continue with this testing. It is imperative that we retain the supplies for those people who are most at risk and for healthcare workers. Toward that goal, though, of having enough supplies, we are very grateful for the ingenuity of our own buildings and grounds crew. Let me show you what they have built. They have built face shields. Would you like to try this on for us, Dr. Hall?
Sure.
These are face shields made out of laminate, a little plastic, and a rubber band around the back of the head. And they're building these downstairs for us right now so that we can have enough of these. We also want to acknowledge and thank the members of the Utica community and the Mohawk Valley for their support and concern for our organization. We have received numerous calls from businesses who have supplies they think we might be able to use, from people who have contacts of manufacturing companies or have other ideas and ways for us to find adequate supplies. That includes from construction companies, from some of the big box stores, and from other general members of the community, some who are out sewing masks at home to donate to our organization. We are so grateful for that support and that help from the members of our community. We ask again that if you are symptomatic, to please stay home. Call your physician for their advice on what to do next. But if you are really sick, please come to the emergency room. And with that, I'd like to turn it over to Dr. Hall.
Thank you, Darlene. So first I'll reiterate my profound appreciation and just actually astonishment for what this community is doing to step up here. The other thing that I would strongly have people think of as a mindset is that act as if everybody is already infected, and keep the social distancing, keep the hand washing going, those kinds of things, cover your coughs. But basically, if you act as if everybody has it, then we are much more likely to stop the spread, okay? The things that we are doing, first and foremost, as Darlene said, is we are running short, potentially critically short, of testing equipment as well as of personal protective equipment, or PPE. And therefore we are limiting who we are testing. We are limiting it basically to 3 different groups. Number 1 is those patients who are admitted to the hospital with symptoms, because we need to know whether they need special isolation or not. Number 2 is for patients with significant symptoms who are also elderly. So we're talking about the elderly or patients with significant comorbidities, so lung disease, diabetes, kidney failure, those kinds of things. And the third, and this may sound self-serving, but it's really not, is healthcare providers who become ill. And the reason we need to know that is because we need to know whether they can continue to work. And if they can't continue to work, then that's going to put that much more stress on this organization and on the community going forward. Starting on Wednesday, again, according to the mandate from the governor, we will be limiting the surgeries that we do. We will be limiting them to essential surgeries. Now, in very broad strokes, essential surgeries are those that are life-saving, those that are limb-saving, or those that, if they're not done in an expeditious time frame, will ultimately result in patients either dying or having significant problems. So that means that there are currently things that we're doing that we will not be doing for the near future. I'm not saying that we're going to stop doing them, because we won't. It's not like we're cutting back on the services that Mohawk Valley Health System provides. I'm saying that for this period of time, as we get ready for the surge, which we all believe is coming, and that as we continue to conserve our personal protective equipment, that we need to take this step. If there will always be questions about whether something is actually an essential surgery in the moment, and we have a process set up where we will evaluate those on a case-by-case basis to understand what the ramifications might be, both for the patient as well as for the institution and community. And we will take those all under advisement in terms of making whatever final decision we make.